Kristin Baird, board certified dermatologist. We're here at Dermatology Center of the Rockies in Longmont, Colorado. We are here with Gretchen today, who is thinking about having Botox. She has not had Botox before, so I think she has a lot of questions, and I'm happy to answer them for her and see what we can come up with today. Botox has been around a long time now, 20 years. There's a lot of safety data on Botox just because of what it is. And how we use it for cosmetics is very different than using it for large muscle spasms.
Okay.
So, you know, there's always risks, but the risks are very minimal with the amount we use for kind of softening lines and wrinkles and movement on the face.
So I'm a little nervous, like what if it reacts differently with me, or what if I can really see or have like little bumps on my forehead? That's pretty much my main concern, and kind of being more earthy, hippie, like I take what I put in my body very seriously, you know, just I think that piece as well. Just wanting to be more natural, I guess.
Well,
yeah.
You know, I practice in Boulder County, and Boulder is very, you know, outdoorsy. People want to look very natural. No one wants to look overdone.
Yes.
You know, frozen, all of those sort of comments I get, and I think that's what I really try and do is, you know, help you look more refreshed, youthful, but like yourself, not like someone else.
Yes.
But more of a refreshed version of yourself, you know, where you still have movement and it looks natural. You just don't have quite so many lines and wrinkles.
Love that.
As far as, you know, side effects today, you talked about bumps, and you know, and a lot of times you have small little bumps that are, you know, just there, but they're usually gone within 5 minutes.
Oh.
And the other thing you talked about was bruising.
Right.
Certainly, anytime we introduce a needle or anything to the skin, there's always the potential for a bruise. Certain things we can do to prevent that. You know, not take things that thin your blood, such as aspirin, Advil, even a lot of the herbs like fish oil and ginkgo biloba. So that will decrease it. And the other thing is we can use ice beforehand.
Okay.
And that just sort of, you know, kind of constricts the vessels. And obviously I train, you know, I see one, I will avoid it for sure.
Right.
But again, Botox, lots of safety data on Botox. People are very happy. The other thing I will tell you, especially for first-time Botox patients, is they tend to be very conservative in the treatment.
Cool.
Because you haven't had it, and it is a little bit of a different feel when you don't quite have that movement.
Yeah.
And I always tell people, have you back at 2 weeks. We can always adjust and add some, but we can't take it out. So I think, especially in this area, people are really happy to take a quick stop in, and you know, if something is still moving or they're not that satisfied. So
you're making me feel better, because that was my other question. Like I have anxiety over that. I'm like, what if, you know, I feel like you did too much or something. I mean, I know you're great, but that would make me nervous, because then I'm like, oh God, how long is it gonna last? And you know, I don't really, so that's good. Cool.
Duration wise, I would say takes effect, I would say in 3 days. 3 days, it's typical,
okay.
But it's not fully. So make all these expressions, your movements, make them in the mirror in 3 days. They're not quite as strong.
Okay.
And then at 2 weeks, it's kind of done what it's going to do.
Cool.
So I'll have you back then, and we can adjust something if we need to, certainly.
But it's not an instant thing. I'm not going to know right away. Okay.
Yeah.
Okay.
Yeah. Which is different than like filler procedures, which are, you know, pretty instant. You get a result. Duration, I tell people 3 to 4 months.
Wow. Okay.
Yeah. So, you know, sometimes the longer you do it, you can get a little more from it, because it does almost get you out of the habit of making some of those expressions.
Okay.
Rounds and the over, you know.
I don't mind that, Tony. I'm good with that. That's good.
And the lines too. So, you know, you have some lines that are kind of just set in already.
Yeah.
So over time, those will soften.
Okay.
So it will look better in 2 months than it does in 1, you know.
Cool.
As long as we have that movement.
Okay.
Put out. But yeah.
I'm
So
excited.
I think you'd be a great candidate. You have a great attitude.
Thank you.
And then, you know, as we go, we'll answer more questions. Your question about, does it hurt? Tiny, like little thing. Very, very small needles that we use for Botox. So most people do very well. Again, the ice can be helpful for that too.
Okay. I'm excited.
Okay.
Let's do
good.
it. I'm
Let's
excited.
get started. Not proud
I'm so excited now.
Starting with a little area here. So
all.
That was it.
Really?
That's
it?
You did it.
Oh, wow.
Like I said, 2 weeks. You know, hopefully we'll get to see you back. Or,
Okay.
You know, if it works with your schedule.
Okay.
And then we'll adjust if we need to.
Awesome.
And then, you know, like I said, moving forward, we'll kind of know what works for you, how many units, and go on from there.
Thank you so much. I'm so excited. Am I allowed to send you a selfie of my
Perfect.
of my
I would love that.
after face? How good
I
it
would
look?
love that, yes. Anyway, I wanted to thank Gretchen for coming down today and sharing her experience with all of you out there today.
Thank you guys so much, and I'll keep you posted. I'm very pleased though already.
What did you think of that?
I'm so excited. Honestly, I thought it would hurt so much more, and not at all. Like literally. Getting my nose pierced and my eyebrow pierced way worse. And I was so nervous because I know people, they can tell you so much about as far as like, you know, every person is different as far as like if you get bumps or if you're gonna have irritation or, you know, kind of bruising. And I loved her, first of all, and I trust her, but you never really know. And I'm like, I just went in the bathroom and I put on a little bit of tinted moisturizer. You can't even tell. Not to be vain, but to be honest, like, you know, it's great. Like, I loved it. I'm really excited to see the results. I think it's gonna be great.
Good.
I'm excited.